So good afternoon, everyone. I'll be talking about, it was a randomized controlled trial between circumferential versus hemigonioscopy assisted transluminal trabeculotomy in primary congenital glaucoma. So far, the conventional treatment of choice for primary congenital glaucoma has been um, um, combined trabeculotomy with trabeculectomy. Angle surgeries lately, it's moving on its own. The slides are moving. Can you just exit and stop timings?
Uh, yeah.
Sorry. So the angle surgeries including GAT have shown promising results in PCG and GAG so far. So the study was basically, there was a confusion in how much to excise. Is it safe to excise 360 degrees of the trabecular meshwork in these young eyes? Does it hamper the trabecular pump function in these patients? And that is why there was no answer to this question even in adult or primary glaucoma at that time when we conducted the study, and hence the study was envisaged. So the aims and objectives of the study was to determine the safety as well as the efficacy profile of GAT in primary congenital glaucoma, and then to compare the surgical efficacy of 360-degree excision versus 180-degree excision in PCG. So it was a prospective randomized study which was enrolled and ethical clearance was obtained. The PCG children with mild to moderate grade with corneal diameters less than 14 millimeters and relatively clear corneas were recruited. It was randomized using a random number table generated, and examination under anesthesia for all the baseline parameters was done, followed by surgery was conducted. So the inclusion criteria I've listed, and the exclusion criteria were anterior segment dysgenesis, syndromic associations, or any other cause of glaucoma. So there were two success criteria. One was the target IOP of 18 millimeter mercury, and the second one was 15 millimeter mercury. And the success was calculated based on both the criteria. And need for systemic acetazolamide or resurgery or IOP hypotony with less than 6 millimeter mercury or loss of perception of light was considered as failure. So in the results, we can see that this rhomboid is the 360-degree GAT, and 180-degree GAT is the circular forms. And we can see that post-operatively, this is the criterion A and this is the criterion B. This is the pre-operative IOP in the horizontal axis, and this is the IOP at 1 year of follow-up. The patients were followed for at least 1 year. And we can see that the rhomboids, they fall more in the lower IOP range in the post-operative period, whereas the hemi-GATs or the 180-degree GATs, they had some shoot in the higher range even after the surgery. So though both the groups demonstrated significant IOP reduction at 12 months, however, whether the cumulative qualified success rate as well as absolute success rate was significantly better for the 360-degree group in these children. So we can see these Kaplan-Meier graphs for 24 months, and we can see that the qualified success as well as the absolute success for both the criteria, they were better in the 360-degree group. Additionally, at the end of 12 months, 4 eyes in the 360-degree group required medications, and the IOP got controlled, and therefore the hypothesis that the medications may not work in the eyes where we have removed the trabecular meshwork circumferentially did not hold true, and they responded well to the medications. So 1 in 5 of every eye which underwent hemi-GAT exhibited increase in IOP. Another important finding was that there was a reversal of cup disc ratio in the eyes which received 360-degree treatment, which was significantly more in this group compared to the 180-degree group. So this is the baseline CDR, and the y-axis shows the CDR at 1 year. And we can see at post-operative period, the CDR was better, and it reversed actually. This is one of the patients which demonstrated reversal after surgery. So this is also an indication that maybe circumferential should be preferred in these eyes. Other than transient microhyphema, which never needed drainage, there was no other complication, but one eye of 360-degree GAT did experience 1 clock hour of iridodialysis, which was not harmful to the patient. So we can conclude that circumferential GAT is superior to hemi-GAT in PCG and offers better IOP lowering, lesser need for medications, and also better CDR reversal, and it can be considered the initial surgical procedure for PCG, particularly for non-severe ones with a better safety profile than CTT. The limitations of the study was a small sample size and short duration of follow-up, and the patients included PCG with a relatively clear cornea. Thank you very much for patient listening.
Excellent study.
Thank you.
What would be the difference because there's some who would other studies also would be saying that 180 is just as good as 360.
Yes.
What do you think?
So that those studies have been conducted not in children but in adults. So all of these studies, this is the first study, and we've been able to publish it accidentally after the submission. So in adults, they say that for primary glaucomas, 180-degree could be as good as 360-degree with no harm of doing 360 degrees, and we also don't recommend doing circumferential treatment in primary adult glaucomas. But in children, we feel that since it is the procedure which is being done under GA, and it's the first chance that we are giving to the baby, that it should, it should leave him a good IOP control for the lifetime. So we think we wanted to know whether we should do what procedure should be the best for the best IOP lowering at the first stage. And we did find differences in a short follow-up of 12 months also. So now we have the second part of the study. It has become the first line treatment in our center. So the paradigm has changed, and we're no longer doing nasal goniotomy or CTT as the first line procedure. But in adults, no, we're not doing 360-degree treatment.
Okay, great. Any questions from the audience? So it's really good that you have this evidence already in terms of shifting your treatment.
Yes.
I would encourage you to go on, continue following up these patients for the long-term outcomes.
Thank you so much, sir.
Thank you very much.